Good afternoon. I hope you've enjoyed your lunch. My name is Heather Templeton Dill. I'm the president of the John Templeton Foundation, and you are in for a real treat. It's always the session after lunch that you worry about because everyone's satiated and you're apt to fall asleep. It's time for siesta, but this session is the perfect session to have after lunch. If you've noticed in your programs, it's called Distinctive Philanthropic Prizes, and I am so honored to have this opportunity to engage with Mr. Mark Gerson and Dr. John Fielder in a conversation about the Lahaina Prize for Outstanding Christian Medical Missionary Service. I also have the wonderful privilege of sharing a conversation with Dr. Cecilia Conrad about the 100 and Change initiative of the John D. and Catherine T. MacArthur Foundation. But before I introduced our guests, Adam also gave me the opportunity to share just a little bit about the Templeton Prize. According to a 2009 report published by McKinsey and funded by the John Templeton Foundation, prizes are a unique and powerful tool that should be in the basic toolkit of many of today's philanthropists. That's a bold statement. At least I think it is. Prizes are valuable. Prizes can be used to achieve particular objectives. However, if we accept what the McKinsey report suggests, that prizes should be an important tool in the toolbox of many philanthropic efforts, then I hope you find this session valuable. Many of you already fund prizes, or you work for organizations that give prizes. Some of you may be contemplating your own prize program. What I appreciate about the Lahaina Prize and the 100 and Change initiative is that both the African Medical Mission Foundation and the MacArthur Foundation thought carefully about the scope of the prize and the process for selecting a winner, and both are already learning lessons that they are writing about on their websites and using to improve the next round of prizes. As you will see, a prize program is indeed a valuable tool in the philanthropist toolbox, and I hope that you walk away with some good advice from these conversations and with an appreciation for the way in which both prize programs are inspiring change and seeking to make a difference. In our case at the John Templeton Foundation, my grandfather, Sir John Templeton, began his foray into philanthropy in 1973 with the Templeton Prize for Progress in Religion. Today, we call the prize the Templeton Prize, but from 1973 to 2001, it was known as the Templeton Prize for Progress in Religion. My grandfather created the prize because he was concerned at the time that many of his friends, especially the best educated ones, seemed to be neglecting religion. He said at the time they thought of religion as uninteresting and old-fashioned, or even obsolete. Sir John's experience was different. Based on his work with a commission of the United Presbyterian Church and his involvement with Princeton Theological Seminary, Sir John observed marvelous new things going on in religion, and he wanted to draw attention to these new things going on in religion. If people only knew, he said, they couldn't help but be uplifted and inspired. Ultimately, Sir John decided to create a prize because he thought a prize was the best way for one individual with limited means, as he said at the time, to have a significant impact. And he took the Nobel Prize as his model. He could have, and he said this too, sent a check to a worthy organization, but he hoped that a prize would have vastly greater benefits. It's interesting, though, that initially he incorporated the prize into his will. 4 or 5 years after doing so, Sir John decided that he might live a very long time, and indeed he did live until 2008. So he put the prize program in place in 1972. The first prize was awarded to Mother Teresa in 1973. We say on the Templeton Prize website at templetonprize.org, in case you're interested, that the Templeton Prize honors a living person who has made an exceptional contribution to affirming life's spiritual dimension through insight, through discovery, or through practical works. It's a prize that honors a lifetime of work. What does it mean, however, to affirm life's spiritual dimension? The Templeton Prize has been given to prominent religious leaders, such as Rabbi Lord Jonathan Sacks, who is the former chief rabbi of the United Hebrew Congregations of the British Commonwealth. The Dalai Lama received the prize in 2013, and Archbishop Desmond Tutu received the prize in 2013. But the prize has also been awarded to scientists because my grandfather thought that progress in religion or new ideas about religious belief, practices, and perspectives could be gained through science. Accordingly, Dr. Paul Davies, who teaches right here at Arizona State University, received the Templeton Prize in 1995. Dr. Davies is a theoretical physicist and cosmologist who wrote books with titles like The Mind of God and The Cosmic Blueprint, and the second book had the subtitle New Discoveries in Nature's Ability to Order the Universe. In his acceptance speech, Dr. Davies said, "The contrived nature of physical existence is just too fantastic to take on board as simply given. It points forcefully to a deeper, underlying meaning to existence." Here's a prominent and accomplished physicist wondering about the meaning of life and the existence of God and the nature of God, if indeed God really exists. And he's asking these questions because of what he is observing in the lab or through scientific research. Is this an example of a marvelous new thing going on in religion? Does it affirm life's spiritual dimension? We think so. In addition to scientists, the Templeton Prize has also recognized extraordinary humanitarians, including Jean Vanier, who founded communities around the world where people with and without disabilities live in community together. But he did not win the Templeton Prize for his humanitarian work. He received the Templeton Prize for the way in which he thought about, wrote about, and talked about his work. His great insight was this: the people without disabilities who live in these communities to care for those with cognitive and physical disabilities learn more from those with disabilities than those with the disabilities learn from them. And often those with disabilities exhibit a deeper understanding of human spirituality. This, too, in our view, affirms life's spiritual dimension. At this year's prize ceremony, which took place about a month ago, I put this idea of affirming spiritual dimensions in different words. I said the Templeton Prize exists to promote the deep and enduring value of religion, religious perspectives, and religious belief. We seek to identify spiritual giants across faith traditions, whether they're humanitarians like Jean Vanier, religious leaders like Rabbi Sacks, or scholars who impact the world through their research like Dr. Davies. Sir John hoped that winning the Templeton Prize would allow each laureate to become more well-known. And as he said, he wanted each laureate to become more well-known, not so much for their own benefit, but for the benefit of people who might be inspired by them. The Templeton Prize, like the Nobel Prizes, is an exemplar prize. We seek to identify those who have made significant contributions throughout their lifetime, and we seek to honor their work. What's less clear, and indeed we are thinking through this at the foundation right now, is the extent to which exemplar prizes actually inspire action or encourage people to pursue the same kind of work. The Lahaina Prize and the 100 and Change Initiative are different in that they both aim to galvanize attention and support around a particular problem. In the case of the Lahaina Prize, Mark and Rabbi Rebecca Gerson had a very particular problem in mind. In the case of the 100 and Change Initiative, the MacArthur Foundation cast a wide net to identify all kinds of problems and then to fund the solution. But all of these prizes, the Lahaina Prize, the 100 and Change Initiative, and the Templeton Prize share something in common. We seek partners for our work. All of us hope that our prize programs will inspire more and more people to become interested and engaged with the work that we're doing. While a prize may be a tool in the philanthropist's toolbox, it's also another area, like so many in philanthropy, where we can work together and share resources. I hope you get a picture of what that might mean as I invite our guests on stage. And now, without further ado, I would like to invite Mr. Mark Gerson and Dr. John Fielder to join me on stage. As they come forward, let me just share a few words of introduction. Mark, who is coming on stage first, is the co-founder and chairman of the African Mission Healthcare Foundation, which supports the work of Christian medical missionaries serving in Africa. He's also the co-founder and chairman of the Gerson Lehrman Group and the chairman of United Hatzalah, which is a network of first responders that treat victims of pre-hospital trauma in Israel and now in Jersey City. He graduated from Williams College. He has a law degree from Yale University, and if that's not enough, he's an author of many books, and he's written articles in places such as the Wall Street Journal, the New Republic, the Weekly Standard, on topics ranging from, and I love this, professional basketball to Frank Sinatra to the biblical Jonah. He's married to Rabbi Erica Gerson, and they live in New York City with their 4 children. Dr. John Fielder is president and co-founder of the African Mission Healthcare Foundation and has been a medical missionary in Malawi and Kenya since 2002. Dr. Fielder trained in internal medicine at Johns Hopkins Hospital, and now, following the model of many missionaries, he raises his own support to serve with the foundation in Africa. He also provides teaching and clinical support to the Mawa Methodist Hospital and other mission clinics in Kenya, where he lives with his wife Amanda and their children. I'm going to sit down with you now and ask you a few questions. So the two of you were friends at Williams College, and you shared rooms or suites or something along the way. John, what inspired you to go into medicine and then ultimately to go into the mission field? If you just describe briefly your call and then your work in Kenya and Malawi.
Well, in medical school, I was very fortunate that I had a mentor who had been a medical missionary teaching medical school in Kampala, Uganda in the 1980s. And if you know anything about the history of that region at that time, that was not an easy thing to do with your family in the 1980s in Uganda. But he spoke very powerfully about how he was able to teach young Ugandan and Rwandan medical professionals, and now those people have gone on to be the leaders in Uganda and Rwandan medical society. And as I was finishing up my training in internal medicine, I thought, well, I can be physician 800,001 in the United States, or I can go and be the only doctor trained in HIV medicine at this hospital in central Kenya. So I kind of did the math, and that seemed to be the right thing to do.
And describe just a little bit about the work that you do in Kenya.
In Kenya, from 2002 until 2006, I was a clinician and an educator, and then later an HIV program administrator. So we were providing, with Mark's help and the help of others, we were providing HIV medicines to patients suffering from that condition before the President's Emergency Plan for AIDS Relief came. And when PEPFAR did come, we were one of the first hospitals to be able to scale up care and treatment for HIV. And then I had a chance to travel around Kenya and help other mission hospitals set up their HIV clinics, and that's how ultimately we came up with the idea to start AMHF. Then later we moved on to Malawi, which is really a country even poorer than Kenya, and we worked at another mission HIV clinic there doing many of the same things. And then we later moved back to Kenya to lead the growth of this organization.
And Mark, what led you to invest in John's work?
Well, ever since I met John more than 25 years ago now, John was the most morally serious, deeply principled, and intellectually rigorous person that I know. And that was true then, it's true now. So John's been an inspiration to me for a long time now. And so I remember when John called me and he said he had finished his residency program at Baylor in infectious diseases, and he said, as a Christian, I'm called to go to Africa to serve the poor. And he went to Africa and worked in conditions which, if I didn't know him firsthand, I would have thought were impossible. And he did it out of faith to serve the poor. So the least that I could do at the time was to support his work. And so we started supporting his work 2001, 2002. And then we realized through the work that John was doing and through his travels that the biggest problem in African healthcare is the lack of providers. So if you need a C-section in Africa, you have a 20% chance of getting it. If your child breaks his leg in a fall, he could wait years, maybe decades, before having any treatment. And the reason is because there are so few doctors. So Malawi, for instance, has 17 million people and 150 doctors, not all of whom are practicing. And many of the doctors who are treating patients are Christian medical missionaries. So we realized this problem was extensive throughout the continent, and it was being solved by Christian missionaries, but they had no consistent source of support. So as Jews, and my wife Erica is a rabbi, and so as Jews, we realized that the Torah tells us 36 times more than anything else to love the stranger. It doesn't tell us at all to love your children, because you don't need anyone telling you to do that. But it tells us 36 times to love the stranger. And then why does it tell us so often, more than anything else, to love the stranger? Because you could go through your entire life and live a happy and fulfilled life and never think about the poor in rural Burundi who have no access to health care. And the people who are administering the care to these people, the people who are really loving the strangers in the most profound form of action, are Christian medical missionaries. So, it's John's faith calling and that of his colleagues to serve the poor in Africa through providing health care, and it's our calling to support the Christian medical missionaries in their sacred work.
So you both set up the African Healthcare Foundation, and then a few years ago, Mark, you and your wife Rebecca decided to create a prize, and I want to make sure I get the title right, but it's a $500,000 prize, the Lahaina Prize for Outstanding Christian Medical Missionary Service.
Right.
So why did you think that a prize, instead of other fundraising or public relations efforts, would be the way to go?
So John and I, we started the foundation in 2010, and obviously the first challenge that we had was to arouse the interest of other people in the work of the Christian medical missionaries who are performing this extraordinary work. And then in 2015, in August of 2015, or July of 2015, Nick Kristof of the New York Times went to the Nuba Mountains between North and South Sudan, and he wrote this article, and the trip he took, it's an extraordinary trip. John's taken it, I haven't. It shows how courageous and intrepid he is, and of course John is. But he did a video, and he did an article about Dr. Tom Catena, who's just one of the most extraordinary people in the world. He's a moral superhero serving the poor in the Nuba Mountains in conditions that are truly impossible, but he does it. Doing surgeries with no electricity, with no running water, often under bombing, but he's there to serve the poor as a medical missionary, and Nick Kristof wrote this piece. And then Erica and I said around Giving Tuesday in November, we said, we'll match up to $100,000 to anyone who gives to Dr. Tom Catena, who we had been supporting for years. And we put a link to the Nick Kristof piece. And then Nick just wrote this small mention, not a column, a small mention in a column about a rabbi and her husband are supporting a Christian medical missionary who's helping everybody in Africa. And the match was filled within 48 hours. And then we raised it, and that got filled. Then we raised it again, and that got filled. And then we said, well, how can we institutionalize this? How can we make this more systematic? So we said, why don't we do a prize? We'll call it the L'chaim, which means to life or to lives. The L'chaim Prize for Outstanding Christian Medical Missionary Service. And John curated the most well-respected group of people in the field so that the winner of the prize would have an imprimatur that he or she could carry with him or her for the rest of their lives. And it's a $500,000 a year prize. And the idea was that, very much as you were talking about your grandfather's inspiration, that a prize would galvanize attention around, in this case, Christian medical missionaries in general and the winner specifically. And so we launched the prize. The first prize was announced last year. It was Dr. Jason Fader, who's a 38-year-old surgeon. He's the only surgeon caring for 2.1 million people in rural Burundi. And he's brought a whole community of Western physicians to rural Burundi to serve with him. So Jason was the first winner after a long process. And it's worked. We've had, for the first time, we've had kind of systematic inquiries and donations and gifts to support the work of Jason and other missionaries, and it's because of the prize. And so we did it again this year, and God willing, we'll do it every year. And I guess we can announce the winner now.
That's right. My next question was to you, John. Can you tell us about the 2017 winner? And I understand they're not announcing this until Tuesday. So because you all are here, they agreed to share about the winner this year. So why don't you tell us a little bit about?
Well, it's my real privilege and honor to announce that the 2017 winner of the Gerson Lahaina Prize for Outstanding Christian Medical Missionary Service is Dr. Russ White of Tenwick Hospital in Western Kenya. Dr. White has been in Kenya for over 20 years. When he first got there, People were dying of esophageal cancer and rheumatic heart disease and many treatable surgical conditions. There were no training programs at all at that hospital, which had been started in the 1930s. He has overseen an internship program and a surgical residency program. And now with this prize, what's really exciting is that it will start the first cardiothoracic, so that's heart-lung surgery training program for Africans between Egypt and South Africa. Why a heart surgery training program? Because rheumatic heart disease, which is a consequence of untreated strep throat, something we don't think about probably in this room, damages the heart valves, and it affects young people, and it is an enormous killer in much of Africa. I had one time a year ago when I diagnosed 3 young people with this condition in one 24-hour period, just myself working in the hospital. So this is a major problem. People think it can't be dealt with, but this hospital is already doing heart surgery, but they need more surgeons, they need more equipment, they need more infrastructure, and they need a community team out identifying kids early so that they either can prevent progression or get them into surgery earlier. So that's a lot of what the Lahaina Prize will do for Dr. White and Tenwick Hospital, and we're very excited about this project.
Great. So, Mark, you referred to this a little bit earlier, but I'm interested in what has been the impact on Jason Fader and also on your foundation as a result of awarding the prize in 2016. And we talked earlier about the relationship with the Christian Broadcasting Network. So if you would give
Sure.
us an image of what the impact of just that one prize so far has been.
Yeah, absolutely. So this is a $500,000 prize, and we could just discuss a few of the things that Dr. Fader is doing with the $500,000 prize. So he's creating an entirely new surgical ward with 48 beds. Now, the reason why this is so important is in the previous surgical ward, I mean, many of us in this room have given birth or have been spouses of people who've given birth, and frankly, we've had private rooms. They didn't have private beds. So after you gave birth, you would share a bed with somebody else. And this is the case for women, and John was explaining all the, I mean, as horrifying as it is, it's medically dangerous because you're exchanging all kinds of bacteria in the bed. 2 to 3 people to a bed, sometimes someone on the floor. And this is a case for maternity and also surgery. So now we're going to have an entire new surgical ward. Another focus of the foundation and of Dr. Fader in particular is the training of African medical professionals so that his skills, his gifts can be leveraged not only today but through the generations. So Jason's established the first internship in Burundi. So before Jason established an internship, you would go right from medical school to treating patients. So now there's an internship program with the medical school class of 30. We'll all be training with Jason. So 4 of them are going to be in the hospital, and that's only $6,000 each. And so the average doctor in Africa will treat 100,000 patients over the course of a conservatively projected 20-year career. So each of those 4 people, that's 400,000 patient visits, which otherwise wouldn't have had the benefit of the kind of training that Jason's going to provide. We've also provided nails for orthopedic surgery, which sounds pedestrian, but without this technology, which has been available in the West probably for 100 years or maybe more, if you broke a leg and you were fortunate enough to get to Jason's hospital, you would spend 12 weeks in traction. In other words, your foot would be up, and 12 weeks. And obviously, that's just horrifying medically, but also we can imagine economically and socially if you're in the hospital for 12 weeks, you otherwise wouldn't have to. Now, because of this equipment, it's going to be a 2-day procedure. And this, I've just described a little less than half of the prize. So just as a businessman who thinks in terms of return on investment, I mean, what John and his Christian medical missionary colleagues are able to deliver is just extraordinary. And in terms of CBN, so after we announced the prize, media organizations covered it, particularly the Christian media, and the best work done on it was by Christian Broadcast Network. They went to rural Burundi, and they went to Jason's hospital, and they filmed it and did a really beautiful segment. You can see it on cbn.com about the prize, but really more importantly about Jason's work. And then Erica and I met over the summer Gordon Robertson, who's the CEO of CBN, and just one of the most extraordinary people I have ever met. You know, right now there's this great friendship, I believe, of world historical significance between the Jews and the evangelicals. And Gordon is the most deeply committed Philo-Semite, I mean, there is. And so we were just, just an extraordinary person. You can see he's made 4 really terrific movies about Israel. I mean, and his knowledge and commitment is frankly inspiring. It's an overused word, but it's true in this case. And so we were telling him about the work of our foundation, how we support Christian medical missionaries, which he knew because his organization had done the best coverage of it. So Gordon said, how can I help? So we just said, we'll put another $1 million to support Christian medical missionaries if you can get your community to match it. He said, done. So John put together a proposal to support the funding of Christian mission training hospitals throughout Africa so that we could really strengthen these hospitals, some of which have been around for decades, but really need modernization and resources to be able to train the next generation of African medical providers. So we've identified 8 of them throughout the continent, and this is going to launch on Giving Tuesday, or slightly before, so about a month now. It's going to be CBN's big Christmas campaign, and it's just a great partnership that we're so fortunate to have with just this fantastic organization.
And I only have time for one more question. John, I'm going to put this to you. 2 components of the prize. When somebody wins the prize, one criteria is that they then promise to speak on behalf of the prize as well as on behalf of the foundation, and then they commit to be part of the board of judges for the next prize for 3 years. Can you just explain why you incorporated those 2 components into the criteria for the prize?
Well, as Mark mentioned before, we did want the prize to galvanize support. The dynamic that's happening now is that with the decline of many of the founding churches, I mean, a lot of mission hospitals are Presbyterian, they're Lutheran. You know, these denominations have seen tremendous declines in participation and giving. And so a lot of mission hospitals are finding themselves bereft of the resources they need to serve their communities. So we wanted to galvanize support for more mission hospitals, including the winner, but even beyond the winner. And so to do that, we would need to have media and need to have the person speak to the media. And we specifically put that into the requirements in the prize because there are a number of missionaries who are in difficult situations and in areas where winning this kind of prize and then publicly announcing it probably wouldn't be possible. So we did have to put in that requirement. And then to have the person sit on the committee, as Mark also mentioned, we wanted this prize to be vetted and approved by very knowledgeable people. Our organization focuses on clinical care, on-the-ground clinical care. So if you think about mission hospitals, think about your local community hospital, maybe your local community hospital that has a teaching component. These are a lot of the institutions that we support on a day-to-day basis. And we're not involved in high-level policy or research. We're more on the ground in the trenches kind of work. And so we wanted people who've done that kind of work and understand these institutions and understand that particular work. And if you looked at our committee, probably most people wouldn't recognize anyone on the committee, but they're people who have served either currently or in the past, mostly as medical missionaries.
Great. Well, thank you so much. When I first met these 2 gentlemen, I said, we only have 20 minutes to talk about this.
Thank you.
Fortunately, they're here today and through tomorrow into
Sure.
Saturday. The organization is African Mission Healthcare Foundation, the Lahaina Prize. Please come find John and Mark afterwards. I'm sure they have many more stories than they've had time to share here. But let's give you both a round of applause.
Oh, thank you.
Thank you so much. And now I'd like to invite Dr. Cecilia Conrad. She's going to come up on stage, and let me just say a few things about Cecilia. She's the managing director of the MacArthur Fellows Program and the 100 and Change Initiative, which is the MacArthur Foundation's competition for a single $100 million grant to help solve a critical problem of our time. And I have to say, Cecilia, I didn't tell you this, but I was driving to work one day thinking, how can we draw more attention to the Templeton Prize? I know we just need to create the most valuable prize in the entire world. And then I think it was the next day that I heard about this prize, and I thought, well, it's already been done. We're not going to do that. But prior to joining MacArthur, you were a professor of economics and actually acting president at one point, and served in a variety of roles at Pomona College, and you have a degree from Wellesley as well as a PhD in economics from Stanford University. So I want to begin by just asking you to describe the 100 and Change Initiative. What is it?
So the MacArthur Foundation, as Heather said, will be making a single grant of $100 million to a single project that solves a problem, takes a big slice of a problem, or unlocks the resources required to solve the problem. And here's the catch. We didn't define the problem. We said to the world, tell us what $100 million can do. We opened this competition in June of 2016. Applications were due in October of 2016. And in the first stage, we had the proposals evaluated by a panel of wise heads, 400 people drawn from a variety of disciplines. I think there are a few judges here in the room. We asked them to evaluate the proposals on 4 criteria that we thought were agnostic with respect to the field. Meaningful, we wanted a solution that would have a compelling and meaningful impact on people's lives. Verifiable, we wanted a solution where there was a strong body of evidence that it would work. We weren't looking for untested ideas. We were looking for ideas that had been tested and tried in one place and might be scalable. Feasible. We wanted to know that you actually could implement this solution given whatever political, social, and other kind of barriers there are, and that your team had the capacity to do it. And then finally, durable. We wanted the solution to last beyond our $100 million grant, that you had to have a plan for how you were going to sustain it. So those judges reviewed all of the proposals, and our board then, from among the highest scoring, selected 8 semifinalists. We then engaged in a big investment in those 8 to strengthen those plans about how they were going to implement it, what we called the engineering plans, a big capacity building investment. And then just recently, as we entered the final stages, we've named 4 finalists. And those 4 finalists are going to be presenting their projects in December, and I'll say a little more about that later.
Okay, great. So there are many ways to design prize programs. How long did the MacArthur Foundation spend in developing this program, and then why was the open call for submission so important to the program?
So the open call was really at the essence of the program, and the idea behind this really started sometime in early 2015 when our then new president, Julia Stash, was charged with refocusing the foundation's attention to focus on a smaller number of problems with bigger investments with the idea that we could have a big impact. But as we did that, we became very conscious of the fact that we were picking the problems that we were going to work on. And we were also kind of designing the strategies about how we were going to address those problems. And she said, you know, we should have a place where we're open. You know, we benefit from having this foundation where the donor didn't really specify a particular area of work that we could do. So it's kind of a special trust that we have, that we should stay open to what are the big problems out there where $100 million could really have an impact. So the openness was really built into it from the beginning. The question then became, how do you be open? And that kind of led us to the competition model as a way of really casting a wide net.
So one of the most powerful features of this program is the way it encourages grantees to think big. They have to come up with a solution that they could spend $100 million on. Now I imagine that this has been really helpful for those who have applied, and that the publicity around this has actually drawn attention to those who didn't make it to the finalist round. Can you just say a little bit about that? Are you seeing other funders coming along and expressing interest in either the top 200 or some of the semifinalists?
So first, just on the issue of what impact has it had on the participants, I don't think I said any numbers. We initially got over 1,900 applications. And those 1,900 applications all got feedback from our judges. They all got really constructive advice on their projects. And what some of them have told us is that this act of asking them to think big had a transformative effect on their organizations. That for some of them it was the first time they sat down and said to themselves, what if we just weren't trying to maintain the problem? What if we were really trying to make a big headway in it? So that's something that we've really taken to heart and think of as one of the benefits of having run this competition. We identified our top 200 and gave them special logos that they were the top 200. And we know that some of them have had funding that has flown to the organizations as a result of that designation. We also have heard from organizations about specific things they've tried. And I want to just give a couple of examples. Some universities use this as an opportunity to hold their own competitions internally for what projects they might submit to 100 and change. And in at least one case, the university tells the story that they found out that in the School of Engineering, there was a professor who was working on a problem, and in the School of Social Science, there was this professor working on the very same problem. They had never met. They had never talked to each other until this open call came. And as a result of the open call, they had ended up creating a single project that was actually submitted to the competition and has received some funding. It's there's a MacArthur Fellow involved with it named Angela Duckworth, who does work on grit. So that's one example. We have heard of other kinds of collaborations that emerged just because we made this announcement. And some of the ones that were kind of exciting to me are some regional collaborations in cities. St. Louis, Missouri had something they've called Forward Through Ferguson that involved the city, the county, local communities, the business community, the universities. Chicago had a submission like this. So it had the effect we kind of hoped of getting people excited. We've also realized now we have a huge database of ideas of how to solve problems. And so one of the other pieces of this is to try and make this information accessible and usable to the larger philanthropic community. And we're doing a lot of things there so that maybe you'll find some projects that fit in with the work that you're doing already. And I'll tell you, some of them are not $100 million projects. I mean, there are projects at multiple levels where you could make headway with much smaller amounts of investments.
And you've brought the semifinalists together as well with Bridgespan to...
Yes, so the semifinalists, so I mentioned we have 8 semifinalists, and I'm going to take a moment just to list them, just because I love them all, and it's really heartbreaking that 4 had to be set aside. So we have the Carter Center, and the Carter Center, as you know, has made one of their specialties addressing neglected tropical diseases. And they had a proposal in front of us to eliminate river blindness in Nigeria. River blindness is a disease that not only removes eyesight, but also causes a terrible skin condition and really interferes with the most productive lives of individuals. That was one of our semifinalists. We have Harvest Plus, that is one of our finalists, that is trying to address micronutrient deficiencies, what is called hidden hunger, zinc, iron, and vitamin A that mostly afflicts people in farming communities where they have not very diverse diets and tend to consume staple crops. And they have a technique called biofortification, relies on traditional plant breeding techniques to introduce biofortified crops. We have the Catholic Relief Services Lumos and Maestral, which is a project to end the way we care for orphans, end the way we care for children. The starting point for this is that 80% of children who are in orphanages in low-income countries actually have a living biological parent. They're not orphans at all, and that parent would care for them if they had support. We have Rice University, and Rice University is working in Malawi with providing technology that's adapted to the low resource setting, to the fact that you have surges in electricity in order to care for preterm babies. I'm always challenging myself when I try to name them all. So I gotta go, okay, I did Carter, I did Harvest, I did CRS, I did Rice, I did Himalayan Cataract Project, which actually I think a little bit about when we heard about the work of the group that just spoke, because they're also focused on trying to build and train doctors in Africa to perform a very low-cost cataract surgery that they have been successfully deploying in Nepal. We have the Himalayan cataract. We have Sesame and the International Rescue Committee, again, one of our finalists, that are working to provide an early childhood educational intervention for children in the refugee regions, the Syrian refugee region, and it does involve Big Bird. We also have among our semifinalists, the Internet Archive Project, which is an attempt to build a massive digital online library, kind of sort of going back to Carnegie, except doing this for the modern age. And Human DX, which is an innovative approach to provide specialty care to people who are in the safety net hospitals here in the US through an e-consult model. So you'll see it's a diverse range of projects. We were really open, and all of them have now gone through extensive vetting, due diligence, and most recently we brought them together for a workshop that Bridgespan led on how to be big bettable, which is, if you put big bettable in your computer, it will always show up red as not a word. The idea behind it is that we've worked with them in lots of ways to build out their plans, and now we're working with them about how to present and message those projects.
So throughout this process, MacArthur has been unbelievably transparent in terms of publishing who makes it to various stages. Why was the transparency so important to the MacArthur Foundation?
I think there was really two parts to this. One part is that we said we were open, and we announced to the world we were open to all sorts of submissions. But there wasn't a lot of trust out there that necessarily we were. So we needed to create a process that people believed would be fair. So we, for example, have all of our judges, their pictures and their bio on our website. We had our criteria and the actual rubric that the judges would use available for contestants to look at and even self-evaluate it if they wanted to. And we told them that we would be making available to the world the ideas and solutions that they were submitting to us, because we also saw that there was value to the larger community in having these ideas be transparent and fully available. We have been writing a lot about the process and our learning. This is the first time we've done this, and whenever you do something for the first time, you're going to have warts. And we've tried to be really transparent about the warts. You can go to our website and see them all.
There's some great articles, in fact, what you learned from a legal perspective and how to make sure you're checking all the boxes. So what is one thing that the wider philanthropic community and the philanthropists in this room might learn from MacArthur's experience? What are some lessons that you've learned that you might apply for a next round, or what do you think the rest of us can learn, those of us who are giving prizes or those of us who are thinking of giving a prize?
Well, I'll try and just name a couple. One is that what we found is there are many, many organizations who have identified a problem, but they're not so good at articulating the solution, and they need some support in that space. So I think that one of the places where philanthropy can play a big role is actually some capacity building with organizations so that they can go from A, the problem, to B, the solution. The other piece to this, I think, is that we're hoping to kind of get our community a little bit more interested in the notion of collaboration. And I'll do a pitch because there's a workshop coming up on that next, right? We think that there are many opportunities here for philanthropists to collaborate and really try to move the needle, solve the problem, as opposed to just kind of sustaining it over time. And so I'll use my last couple minutes to point out that you have brochures about the 4 finalists, and that we have this big event on December 11th, which I'm happy to give you a card about, or any of my colleagues are. And we are inviting other philanthropists to come and have a first meeting with some of these incredible projects. It will also be live streamed, and so there's an opportunity to participate if you don't want to come to December in Chicago. We debated that for quite a bit. We should have come here. That's what we should have done. But I think that's the other thing that we hope is a takeaway from this process, this focus on solving problems and a willingness to be open. Although I will say that I think one of the values of what we've done is that in some ways we've done this work for the community. You know, we've got a database, and if you want to know what you might get from a really wide open call, our database is open to you. You can go and look on our site. We're working on some additional collaborations. The Foundation Center will be launching a portal devoted to 100 and change with all of our projects. And the Center for High Impact Philanthropy at the University of Pennsylvania is doing a special issue of their High Impact Giving Guide that will focus not on our semifinalists, but 10 or 12 other projects that they have identified from our top 200 that they think represent really opportunities to have a high impact from your philanthropic giving.
Great. Well, thank you so much, Cecilia.
Thank
Stay
you.
right there. We're going to give you a round of applause.
Oh, okay.
But I want I just have a few closing comments, and I wanted you to stay for this time. This is, I've just had such a great time preparing for these two conversations that I had before you, and I want to thank Adam and those who put together the annual meeting for thinking to have this session distinctive philanthropic prizes. We often say at our Templeton Prize ceremonies there are no other prizes in the world like the Templeton Prize, and I still think that's true, but
It's true.
the 100 and Change Initiative, the Lahaina Prize are equally stunning, and it's just been a privilege to have this be part of the conversation here at the Philanthropy Roundtable. Effective philanthropy is about innovation, and as we've just seen, there's so much opportunity to innovate and to think big and to try something new and to learn from what you try and what works and what doesn't work when creating a prize program. So I really hope that the conversations I've had the opportunity to have in front of all of you have inspired you or helped you to ask questions about your own giving and your own philanthropy. And as I said before, Mark and John and Cecilia are around. I only had 20 minutes to showcase the work that they're doing, and please come forward and talk to them. If you don't have an opportunity to do so, there is so much on both websites for the African Mission Healthcare Foundation and at the MacArthur Foundation about the prize programs, the thought that went into them, and what they're trying to accomplish. So don't forget to come talk to me about the Templeton Prize, too. I'd love to share what we're doing, and we have a website as well. So another round of applause for Cecilia, Mark, and John. Thank you very much.